How is a muscle biopsy performed for muscular dystrophy? Have you ever wondered how doctors diagnose muscular dystrophy? One important method is through a muscle biopsy. This procedure involves taking a small sample of muscle tissue for examination. It helps confirm the presence and type of muscular dystrophy, especially when genetic testing results are unclear. The first step in a muscle biopsy is selecting the right muscle. Doctors look for a muscle that shows signs of disease but is not too damaged. They often choose a muscle that has moderate weakness, typically graded as 4 out of 5 in strength. This ensures there is enough healthy tissue for analysis. There are two main ways to perform a muscle biopsy: open surgical technique and needle biopsy. In an open biopsy, the skin is cleaned with an antiseptic solution. Then, local anesthesia is applied to numb the area. A small incision is made to expose the muscle, and a piece of tissue is carefully removed. On the other hand, a needle biopsy uses a special needle to extract a small core of muscle tissue without the need for a larger incision. This method is less invasive and can be done more quickly. After the muscle sample is collected, it is sent to a laboratory for analysis. Pathologists examine the tissue under a microscope and use specialized techniques like immunohistochemistry or Western blotting. These tests help assess the muscle fiber structure and check for specific proteins, such as dystrophin. The presence or absence of these proteins can help differentiate between types of muscular dystrophy. For instance, the absence of dystrophin is typical of Duchenne muscular dystrophy, while Becker muscular dystrophy may show partial presence. While muscle biopsies are generally safe, they do carry some risks. These can include bleeding, bruising, or infection. In rare cases, surrounding tissues might be damaged. However, the information gained from a muscle biopsy is invaluable. It guides treatment and management decisions for patients with muscular dystrophy. In summary, a muscle biopsy is a carefully planned procedure that involves removing a small muscle sample under sterile conditions. This sample is then analyzed in the lab to confirm and characterize muscular dystrophy. It remains a key diagnostic tool, especially when genetic testing does not provide clear answers. Always consult with healthcare professionals for personalized advice and information regarding this procedure.